Hi, I'm Brittany Wirtz, and I'm here demonstrating how to insert and remove an NG tube. Alright, first, this is my patient. He's going to be in a bed. Because he is conscious, I have him sitting in high Fowler's position. If he was semi-unconscious or unconscious, I would put him in a semi-Fowler's position, but this is going to be the patient's bed. He is sitting upright, and we're going to go forward. So first, before I perform this, I need to make sure that I have confirmed doctor's orders. I'm going to introduce myself, identify the patient using two identifiers, will provide safety, will provide privacy, and will explain the procedure that I'm doing. Alright, now first I'm going to start off by washing my hands, and then I'm going to glove up with non-sterile gloves. Now first I'm going to check to make sure if the patient has any abnormalities, any other problems. So I'm going to ask you to tilt your head back. I'm going to check the inside of both nares. Open your mouth, say ah. Check to see if there's any obstruction in the back of the throat. Then I'm going to press on each snare and ask you to breathe through. Can you breathe? Fantastic. Very good. And then I'll also make sure to see if there's any deviating septums, any traumas, any surgery, or if the patient was on anticoagulants. Cool. Now, moving forward, I'm going to provide a towel on their lap, as well as a basin in case they need to vomit. And then I'll also have the patient hold a cup of water with straw. Now, also prior to doing this, I'll double check to see if the patient has a gag reflex. Open. I'm not going to put this in, don't worry. Gag. If you did not have a gag reflex, I probably would not proceed. Now, I will go forward and get the appropriate length NG tube, which I have here. To start, I'll just coil it around my fingers, get it all ready, and now I'm going to measure it and mark it with a marker. Sorry, I need to pull this hat up. So after I just measured to the xiphoid process, I'm just going to take a measuring tape, add 4 inches, and that will be my indicated space that is going in. Now, with the tube, I'm going to either lube it up with some water, or I will take a lube and lube up the tip about 4 inches of the tube to make sure it's going to go in. Got that. Tissues are here for the patient whenever, should they need, if they start to cry, a tear, they will be able to use this. Now, going forward, I'm going to have the patient tilt their head back, and I'm just going to insert the tube up their nare as such, and then I will gently start to press it all the way until I hit the nasal pharynx. Once I feel that resistance from the nasal pharynx, I will just gently push a little bit past it. And then at this point, I will turn it to 180, so it can go further down. Now, I'm going to have the patient tilt your head forward, and you're going to start taking a little bit more. You're going to start taking sips of water. Now, with every sip, I'm going to just keep pushing further and further. And I'm going to keep going until I hit my marker. That I put onto the to the tube. So it hits here. And that will be the NG tube, and that will be hitting the stomach like such. Hold on, I'm sorry. Now, with tape, I'm going to temporarily secure the tube to their nose. I'm sorry. Very good. Take a syringe. I'm going to put the stethoscope underneath their shirt, on their stomach, and I'm going to aspirate, push in at least 30 mLs of air, and I'm going to listen for a swishing noise that is in their stomach. This will indicate that the NG tube has reached the stomach, did not go past the stomach into the duodenum, or completely bypassed all of them and accidentally went into the lungs. If it went into the lungs, I would pull out the NG tube and reassess. Now, while there, I'm going to aspirate the contents, the gastric juices inside of their stomach. I'll pull out maybe 5 mLs and then assess the contents of the gastric juices, making sure they're a tannish, greenish color. And then I will check the pH status of it. And I'll make sure that their gastric juices are between 1 through 5.5. Yeah. Cool. Now, patient, how are you feeling?
I'm good.
Good. Since the patient can speak, that means there's no obstruction. And also, if you don't mind opening your mouth, be checking, say ah, be checking that there's no coil tube. The tube didn't coil in the back of their throat. So that's going to be the NG tube. Then I will hook up this content to either a suction or the feeding system and feed appropriately. Sorry. Cool. And then from there, I'm going to document everything. Document the date, the time, which nair it went through, the tolerance level that they went through, any abnormal findings, the length of the NG tube, and take off my gloves, wash my hands, ask if the patient needs anything else prior to me leaving. This is the call bell, and that's it. Now, for removal of this, I can take that from you. Actually, no, still hold that. I will take this from you. Very good. So, prior to removal, I'm going to make sure that the doctor's orders indicate that the patient can tolerate food orally now. So once I get that, then I'm going to move forward. I'm going to wait at least 30 minutes after their last feeding through the NG tube. So we're going to get there. Then I'm going to, if it's hooked up to a suction, turn off the suction. I will remove this from the machine. We're going to remove that, and then we are going to move forward. So I will take this syringe. I'm going to draw up at least 10 mLs of normal saline, or I can do air, but I'm going to do normal saline. And then I'm going to flush the normal saline through the tube. This this will remove any gastric juices through the tube, so when I'm pulling it out, it doesn't mess up the lungs or the esophagus. Then I'm also going to check the stomach area to hear that peristalsis going through the stomach to make sure it's still there. I'm going to unclip the tube from their hospital gown. I will place a plastic bag in their lap. Mind holding that? Thank you. And then I have tissues nearby too. Cool. So, I'm gonna clamp the tube here. I'm sorry. Cool. I'm gonna clamp the tube right here, and then I'm just gonna start to remove the tube gently, but also fast at the same time. So, I'm going to place this in the bag to make sure no juices or contents get on the patient or me. And this will go in a biohazard bag. I'll have the patient blow their nose. You don't really need to blow your nose. Damn it. And then I will also make clean your nose with some gauze. And then tilt your head back. Double check for any trauma. Open your mouth. From the NG tube. Then I will document, take off my gloves, wash my hands, lower the bed all the way down to its original position, ask if they need anything else prior to me leaving, remember the call bell, and that is my example of insertion and removal of an NG tube. Thank you for watching my video. Be sure to hit the like button down below and remember to subscribe to my channel. I make videos every Wednesday. Bye!